Dr. Ton.
Hello.
Okay, I'm signing off.
How are you, Dr. Ton? It's so great to
I'm
actually see your face, your handsome face, great smile. Look like
well, it's so
so looks like you were able to do something and keep your beard all clean cut.
scissors. The scissors right over here. How are you doing? It's so good to see you.
And you too. I'm good. It's been, a bit overwhelming. But
Yeah.
I just love this new series that you've come up with, Coping in the Community, because this whole thing with how we cope with what's happening, it's over the top, for a
Yeah.
lot of us.
I think it's been very hard, and I think there's been a lot of uncertainty.
Yes,
You
yes.
know, not knowing people down.
I think there's a bit of a delay.
But
Okay.
is there?
Yeah,
How are we doing now?
we're okay.
Okay. Yeah, so it's been stressful for you these days?
It has.
How's your
And
family doing?
my family is doing good. All of us, we're kind of spread apart. Me and my mom, we live in the South Sacramento area. We have some folks down in Los Angeles, and I have my daughter that lives in North Sac with her son. And then I have another one. She has 4 children at home, small children. So it's really tough, I think, for a lot of the parents, especially if you're single parenting and you're working at home and
Yeah.
you have small children that you have to deal with 24/7 now. That's like huge.
Mm-hmm. Trying to juggle both the responsibilities of work and your kids, and young kids, when you're home, they kind of expect you to be with them.
Yep,
And so trying to balance that out is very challenging.
it is. It is. So let's just get right into our Q&A, because I don't want this to go longer than 1 hour. And as we had talked about, we have a writer that's going to be reviewing the video and pulling together the advertorial for the June issue that we will definitely send to you for review before we go to print.
Thank you.
Okay.
And thank you for partnering with us on this.
Yes. When I first saw your video and you did the whole meditation thing, I've been told, Lachette, you need to meditate more. And so you can relax to start your day. Tell us more about, who came up with this fantastic idea for this video series.
Well, it was actually one of our leaders from the health system, the leader of our Latinx Staff and Faculty Association, which is a group on the health system that is charged with really celebrating and advancing Latinx and Chicanx culture celebrations. Mm-hmm. So her name is Yvonne, and she came up to me and said, Dr. Ton, there's a lot of stress going on related to COVID-19. Can we partner together, you and I, and our association, and talk about some of the ways in which we can cope through these hard times? And so that was sort of the impetus for the Coping as a Community with COVID-19 series.
I love it. Okay, so now, the biggest thing is that, everybody's like, what is this COVID-19? I know in March, when I started getting wind of it, I was one of the folks, and I'm just going to be frank here, who said that it's nothing more than just the common flu, and then people started saying pneumonia. So tell us, why it's different or from the flu and the pneumonia.
Sure. Yeah, so So COVID-19 is a kind of virus that is part of the same family, its same extended family as the common cold. And it acts a lot like the flu or the common cold. For most people who get it, they get, no symptoms at all. For some people who get it, they may have a cough, a dry cough, or a fever, and then it kind of goes away, kind of like the flu. But the difference between COVID-19 and the flu or the cold is that it tends to be more contagious, okay? And so while the common cold and the flu may be somewhat contagious, the COVID-19 virus is much more contagious. So that's every person that gets it generally infects 2 other people. Okay. Whereas with the flu, it's more like a one-to-one. Every person that gets it tends to infect on an average of about 1 other person. So because of that, because it's more contagious, it spreads in our community more quickly. The other thing that makes COVID-19 different than the flu is that it can be more lethal for people who are vulnerable. So in that way, it's like a pneumonia. It can actually develop into a certain kind of pneumonia that requires hospitalization. Now, generally, we see that people who are older, over 65, or people who have asthma or heart disease or poorly controlled high blood pressure, those folks are at more risk for having a more serious version, a more serious response to the COVID-19, so that it can go into the lungs and develop pneumonia. Now, fortunately, there are treatments that we are developing for it as a country, and some of those are you read it in the newspaper. But it is more, it is something that we need to be serious about, even though most of us who get it won't feel any more than a cold or maybe at worst the flu. We're really concerned about the people who are more vulnerable, our elders, our people who tend to be more sick or, more vulnerable, who have poor immune systems.
Okay, that makes sense. So, as we talk about that, so many of us are scared, very confused by COVID-19. And the series that you've developed, how do you see it addressing personal health issues? Like I said, you opened up with a great segment, with the whole meditation. So we're all wondering, how is this going to really address our personal health issues?
Yeah. Well, first of all, I think that, meditation is something that we could do pretty quickly. It could take you 1 minute, take you 3 minutes, take you 5 minutes. It's sort of a skill that you practice, but as you get good at it, it can really help calm your nerves down. And did you know that 500 million people across the world meditate? And, about one to 2 in every 10 in the United States have tried meditation. So it's something that's catching on, and people are doing it more and more for wellness. So if you've seen our videos, I start out with a meditation to help everybody in the webinar sort of reset, sort of calm yourself down, so that you can be more open to thinking, to sharing, to being in the moment. And that can be really important, because oftentimes with the news going on so quickly, with things developing, it feels like it develops so quickly that you can go from one moment to the next without even thinking about how you're slowing down or how you're taking care of yourself. Well, meditation helps you to do that, and it helps you to remind yourself that, hey, you know what? I need to take care of myself so that I can take care of my business or my family or those that I love. Now, our series, we have an ongoing weekly series. Everyone is invited to it. We send out a link, and we'd be happy to share it widely. You just come, you register, you come and you join us. We start out with the meditation, and then we talk about a particular series of topics that are of concern to the community. So we've talked about how do you cope personally, and I've talked about various strategies that have been shown to be helpful in studies and in common practice. We also talk about how do we support our children? How do we support our community? How do we fight racism and bias that happens when pandemics happen? You know, with most pandemics, there are people who tend to be blamed. You know, during the HIV/AIDS epidemic, LGBTQ people were blamed. During this pandemic, Asian and Asian American people were blamed. And so we also, you know, the virus doesn't discriminate against people. It's going to affect people of all, you know, all backgrounds. So we shouldn't really be discriminating either. And yet that's going on. And it's something that, you know, is an outcome of fear, but it's something that we can as a community combat. And so we talk about those practices in our series. We really focus on things that are practical, things that you can bring home to your family, to your loved ones, or to your work, so that you can have some tools to help you through this.
Wonderful. I think it's so important, and it's so good that you're breaking down these issues for us, and you're, you know, having these weekly series and having different, you know, people, guest speakers talk about this different subject matter. It's excellent because, you know, everybody's at home. I mean, this is when you have really everyone's captive audience like you've never had before. You know, like this is like the best time to do anything on Facebook video or YouTube, just because, you know, everyone's at home. I saw on the news this morning that I think Netflix added 16 million, if I'm right, more subscribers for their network. That's incredible. Are you there?
I was breaking up a little bit. I heard 16 million.
Yes, 16 million.
But I didn't hear what the
Netflix.
Oh, wow.
I heard that on KCRA3 this morning, which is just incredible because, you know, when we talk about everybody's at home. So for the most part. Now, another one of my questions is, I'm one of those people, we tend to overreact and exaggerate. And, you know, you got a lot of folks that are wondering if the federal government and the media has done this as it relates to governing society and keeping us informed with accurate information. What are your thoughts on that?
Yes. Well, the first thing I want to say is that it's normal to overreact or to exaggerate when there's so much uncertainty. That's a common human reaction. When you don't know, when you don't have the facts, when you don't have the information, or you get the sense that the information that you're getting is somehow not really making sense for you, or doesn't really resonate with you, that uncertainty can cause your anxiety to increase. And when your anxiety increases, it's very natural to react much more strongly than you normally would in any other situation. So I want to say that that's normal. But I also want to say that there is a way you can address that. And that is, as you were alluding to, Plachette, by getting information that is reliable, that's accurate. So what I tend to do is, you know, I tend to recommend that ask people who are healthcare professionals in your community.
Yes.
Maybe go to call on your family practice doctor, call on your pediatrician, call on your nurse practitioner.
Right.
Those folks have accurate information because that's part of their job. If you don't have access to healthcare professionals, then the other opportunities to get information is through your local health systems and public health departments. So for example, at UC Davis Health, we have a number of websites actually that's geared towards helping our communities understand how to stay safe from COVID, keep up to date on, the latest relevant material, news. And then you can also look at the national website of the CDC, the Center for Disease Prevention. And that website has very good information. A lot of we healthcare professionals will refer to that information to help us to stay up to date. Now, what's also important is that too much news can be activating. It can be overstimulating. And to tell you honestly, for most of us, the news doesn't happen that quick, that doesn't change that quickly. So spend your time, maybe 10 to 15 minutes in the morning to watch the news or to read the news. And then spend 10 or 15 minutes in the afternoon to read or watch the news. That's really about enough that you need. About half an hour will give you what you need to help you to feel certain about the details that are important without overstimulating yourselves. I think that when we watch too much news, it stops feeding us facts, and now it starts to feed us more anxiety, more emotions. And so we have the opportunity to cut that off. That's within our power, to cut that off. Get what you need. Be disciplined about it. There's such thing as too much of good thing for anything. The same thing applies to news. Take your time. Take some time in the morning. Take some time in the afternoon. The rest of the time, attend to other things that are more important and relevant.
You are so right. So no more than 30 minutes, whatever time of the day you decide to consume or watch the news. I agree. We definitely have to stay updated, but, I have to admit, I've become so consumed with the news. Sometimes I'll actually spend 2 or 3 hours just sitting there watching it, and then the president and the governor comes on. I'm like, you know what? It's like you said, it's not changing the content of the information. It's just a new way of how they're maybe saying it. So, yeah, I'm definitely going to follow that rule of thumb, Dr. Ton. Okay, next. The sense of community and how we naturally come together for meetings, conferences, and small to large events has been jeopardized. So we are forced with these Zoom webinars and video conferencing. This has been a true adjustment. What are your suggestions for some people who have not made the adjustment or having a hard time, with this whole Zoom thing? And some people just refuse to do it. They're just like, I'm going to wait until we can meet in person. But what are your suggestions on that?
Yes. So one of the things that is really important about keeping up our immune system and keeping up our mental health is social connection, our relationships. And while, a lot of us are calling what we're doing social distancing, I want to really reframe that and to call it physical distancing, because that's what it really is. We're staying 6 feet away from each other to make sure we have physical distance so that we're not passing on the virus. But social connection is still really important, and we can't take that for granted.
Right.
It helps with our physical health and it helps with our mental health. So that's the first thing I want the first message I want to send is it's really important. And I really want to encourage you to prioritize that as part of your wellness. And for those of us who are, more familiar with the technology, we should be reaching out to those that we love, our friends and our family, who are less comfortable with it. And maybe we start out with a phone call and we walk them through how to use some of the technology so that it's easier to use. A lot of this is that people are unfamiliar with the technology. They're feeling really anxious. They're feeling kind of lost, and they need a helping hand. And those of us, especially the younger generation who have grown up with these kinds of ways to communicate, take some time to help out people who aren't. That's the first thing. The second thing is while this pandemic has definitely made it hard for us to connect in some ways,
Mm-hmm.
it's actually made it easier for us to connect in other ways. I'll give you an example. My kids are communicating with their cousins from across the country. They're doing it on a daily basis now.
Mm-hmm.
They're forming these connections. The kids, watch our kids. They're so resilient. They go on Minecraft or Roblox, which are these online games where they build together. So they gather as a group and they start building together. And so they're forming communities, virtual communities, and they're getting support from one another. They're staying connected. We have a lot to learn from our younger generation. So in some ways, this is a way for us to connect to people who normally, from a physical standpoint, we're not able to connect with in everyday life. Now, because of the technology and because we're thinking more about ways to connect, we're thinking about broadening and extending that connection. So if you have family in another state, this is your time. Everybody's thinking about it. And here's the thing. Whereas before, most of us have been really busy. We're working a lot and we don't have time. And maybe there's the time difference from the East Coast or the South to California, where it's really hard to connect.
Yeah.
Now, a lot of people are having more time. And so make that effort during those times. I've found that a number of my patients, so I'm a psychiatrist and I actively practice. A number of my patients have actually talked about how during this time, they're connecting more to people because whereas their families were, really busy and didn't have time for them, now there's more time for them. There's more time to build community. Yes, it looks a little bit different.
Yes.
Because we're doing it online. But that sense of I care about you, that sense that I want you to do well, that sense that I want to hear what's been going on for you, that doesn't need to change. And yet, and we have time now to really be able to engage in that way and support one another.
Well, I love that. And I'm so glad that we're recording this because a lot of what you're talking about, those virtual games in building community, those are good resources to pass on to other families, especially parents who have children at home. And the idea of, kids doing more than just being on Instagram, right? Taking photos or what other silly stuff they're doing. They need to be doing things that's stimulating them where they're learning. And that whole thing that you saw, those two virtual communities that you talked about, definitely going to be taking notes on that, include in the article. So you kind of probably addressed this already, but how do we decrease our stress and anxiety levels that we may be experiencing, especially the parents and the single parents? I would like you to talk specifically about them and how they're at home with their children, because we have parents who are forced to homeschool and also probably have their office at home. And if, you got the single parent, then you got the married, parents as well, who may be at home with their, home office and small children that they have to homeschool.
Well, first off, I can relate. I have two teenage kids at home, and they're 17 and 14. Oh, and they're really craving social interaction. They're old enough to do some cooking, but they still need some support and some routine. So I'll talk a little bit about both what we're doing at my household, as well as what I advise my patients and families. So the first thing is, it's important to set a routine. Kids do well with routine, even though they'll fight you tooth and nail about routine. It's actually healthy. It's actually healthy for all of us to have a certain level of routine, especially in this time where there's so much uncertainty, that it's nice to know that I'm going to have lunch with the kids at noon. I've scheduled that into my meeting time. So things like that. Routine is very important. It's important for ourselves. It's important for our kids. And as you're scheduling your routine with the kids and with yourself, don't forget to build in breaks. Oftentimes when you're online, you can sort of forget about the time, and before you know it, you haven't drank any water, you haven't eaten anything.
Right.
So make sure you schedule in breaks.
Yes.
For little kids, set up virtual babysitters and play dates. So this is really important. You know, you can have aunties, uncles, grandparents. Reach out to those folks. They can talk on the phone with the kids. They can do FaceTime or other online, so
Great
they
idea.
can help out as you're doing some work.
Yes.
And maybe they have some time this time, and it's kind of nice because for many of us, our extended family are not close by. And there's a sense from maybe grandparents or aunties and uncles that they're watching their nephews or their grandkids sort of grow up in a distance. Well, this is an opportunity for them to actually be with the kids, online, of course, but being with the kids in real time. And that feeds that sense of usefulness, that sense of connection, the sense of being needed, that brings families together. So reach out. Don't be afraid to reach out to uncles and grandparents. Reach out to friends. Arrange play dates. They can be virtual. They can be kids talking to each other. Like I said, my kids, they're doing play dates with their younger cousins. So I have a niece that is in grade school, and my kids will call her up and they'll go on Roblox and they'll sort of play together, and it's kind of like a babysitter arrangement that's healthy for my kids and healthy for my little niece as well. Plan activities that don't need supervision as well when you're at work. So things like activity books, activity applications on your tablet, computers. Those things can help, and you can ask your parent teacher association or your teachers for trustworthy applications. This is, you know, I grew up in a time where documentaries and PBS was how I learned as a kid. And so with Netflix, and there's such a wealth of documentaries. My personal favorite is Mind Games. It's a documentary on how people think. And my children, one of my children, loves to watch that because it sort of helps them understand, well, why do people do what they do?
Wow.
So if you've got a really curious child, you know, find some documentaries, speak with other parents, speak with teachers. Those are opportunities for them to learn, and with, you know, either public broadcast television, if you don't have Netflix, or if you have Netflix or Hulu or those other services, they've got a lot of resources there. If you're working, be upfront with your bosses and your colleagues. I have a kid, you know, they may come in, I just want you to know, you know, it may take me a little bit of time to complete some things. I'm working on a schedule where I'm also taking care of my kids. Most employers will be understanding about that. We all are in this situation together. We're all trying to work together around this. And there's a lot of appreciation as well that people are working from home and helping to keep things running in the businesses, the nonprofits, and the organizations that are needed during this time.
It's multitasking to the 100th power that we've, you know, never had to do before, and now it certainly comes into play.
Yes, and this is where I think it's really important. We are multitasking, and when we multitask, our level of like activation, or, you know, our like our blood pressure kind of like elevates a little bit.
It does.
So this is a time where, yeah, so it's really important, and you can go through the entire day multitasking without knowing it, and by the end of the day, you're feeling more tired than you normally are if you had been at work. And so this is the time where it's really important to take those breaks. Here's some things, some tips that I have used.
Mm-hmm.
So if you're having Zoom meetings, and if you don't need to be in front of the computer, take a walk. Take a walk and take your phone with you. Walk and
Nice.
talk and have your
Good
meeting
idea.
at the same time.
Yeah.
If you're a supervisor or you're a manager, make that okay. Set the example. Suggest to everyone that can, hey, let's go walking together. We're in different parts of that city, but that's okay. We're going to be online together. Let's walk together. Walking, exercising on a regular basis helps bring down that blood pressure, helps bring down the anxiety, helps improve your mood. So I think there's a wonderful opportunity during this time and space to do that. It used to be that I would have meetings in conference rooms. There was no way for me to exercise. Now I can meet with 10, 15 people over online, and I could do some walking as well.
Right. So you do that in your neighborhood. You'll just go.
I do that. I'll do that in my neighborhood. If it's too cold, or if the situation is that I can't do it in my neighborhood, I'll walk around I'll walk in my home. I like to walk as I think, and so I walk around the home. I walk here, sit there, and then walk somewhere else and sit there. I'm just changing my environment.
Yes.
Because changing your environment helps to sort of stimulate your brain, helps keep your brain active, and helps you be mindful of your environment, which again is a healthy habit to develop.
Outstanding. I love those tips. Okay, now, big question, because this COVID-19 test, especially with the announcement of the new at-home test, should we be concerned with this test if we don't have any symptoms or we have not been sick?
Well, so the COVID test is something that I think is a really important development. UC Davis has been working really hard in collaboration with government and with other organizations and universities to really expand our ability to test. You want to be careful about testing and make sure that the testing is accurate. So that's the first thing.
Right.
And so, make sure that you get it from a reputable source. At this point, we're really recommending that people who are in the front lines of healthcare and other essential operations, they're the ones that we should think about as having priority to get the testing, because they're the ones that are out there being exposed and also potentially exposing others. And so it's important for those folks to be tested. We don't have the capacity right now as a society, as a country, to test everyone. So we have to be really smart about how we use our test and make sure that we use the test in a way that really has the most positive impact on all of our communities. And that's why we're thinking, if you're a healthcare professional, with symptoms. So that's the other important thing is there's really not a need at this point, and it's not indicated by our public health officials at this point, to get tested if you don't have any symptoms. If you do have symptoms and you're a healthcare professional or one of the essential employees, that's more of an indication to get testing. Now, this is all evolving. And so we'll find out more as our testing gets more solidified, as we get more test kits as well. But for the time being, if you don't have any symptoms, there's really no need for you to get tested.
Okay. So when we talk about the COVID test, we got to talk about vaccines. As they've been talking about they're working on the vaccine, might not be one for almost 18 months. Now, I'm not too keen on vaccines. I'm really kind of scared of vaccines because I had a bad experience with the flu shot. So, what would you share with those of us who are scared of these vaccines and the side effects?
Yeah. Well, so let me explain a little bit about how vaccines work. So first off, our body has this natural ability to fight off infections that we've already been exposed to. So think about the chicken pox.
Okay.
So when you get the chicken pox, it is really unpleasant. I remember the chicken pox. I was, many of us were of the era when there wasn't a vaccine and we got chicken pox as children. After that, though, our body responds. Our body responds by developing immunity to that virus, the chickenpox virus. So vaccines basically help stimulate the body and give the body a heads up that, hey, this is an infection that's important. And I want to give you a heads up so that you can develop some antibody to it without having to go through the entire illness.
Mm-hmm.
That's what a vaccine does. So basically a vaccine is something that triggers, that activates our immune response without us having to go through the entire illness. So in a way, that's really positive. Now, some vaccines like the flu vaccine, you might feel off for a day or two. You might have a sore spot. You might feel under the weather for a little bit. That's that's one of the challenges of some vaccines, and we don't really know at this point what the COVID-19 vaccine will look like. But I sort of think about those kinds of reactions to vaccines like working out. Okay,
Yes.
so those of you who work out, do some weights, maybe do some jogging, some running. Mm-hmm. How does it feel like on that first day after? Doesn't feel very good. Sore. You're tired, right?
Yeah.
But the body is taking that information. It's taking that information and saying, hey, you know what? That's information for me. I'm going to use that information of what's going on with my body, and I'm going to build it stronger. That's what a vaccine is. The body uses that information. Hey, there's something here that's making me my body feel like, hey, I gotta respond with strength to this. Mm-hmm. And then the body responds with strength to it. But again, the key thing about the vaccine is that it helps you to not have to go through the entire illness to develop an immunity. Like if you can imagine, Plachette, maybe you felt bad for a day or two. If we get the flu, we're out for like a whole week, and it feels really bad. Mm-hmm. And so that's sort of what I think about. I think about vaccines are, they're not 100% comfortable, but they're a lot more comfortable than the actual illness. Mm. And it can help your body to take that advanced notice and say, hey, you know what? There's something here that I can build immunity to, and I better do it. And after you get the vaccine, your body's stronger, just like in exercise. You're building your body. You're making it more resilient. Mm-hmm. You're strengthening it.
Okay. So when we talk about the vaccine, and should we be worried, as President Trump is now allowing governors to open up their states. He's leaving it to the governors to, open up their states. Georgia's opening on the 24th. You got Florida that opened up. Thousands of people went out to the beaches. Should we be worried that within the next 3 to 6 months or even the next year that we are eventually going to get coronavirus?
So those are some really important questions. And I know that, our state has been, our state and city government have been working very closely with public health officials and healthcare providers to make a really well-informed decision about, how long we need to shelter in place. Yeah. Now, in the ideal world, we shelter in place until we have the vaccine available, and then we can start to go out. But I think that the concerns that some people have is that economically, they can't stay, their businesses can't take it for that much longer, or they're concerned about income. Those are real concerns as well. What I would say is that as a healthcare provider, and I fully disclose that, my big lens, my big perspective is I want everybody in the state of California and the world to be healthy. So that's my bias. I just throw that out there.
Okay.
And what that means to me is that whatever we do, we need to make sure that we continue our physical distancing. Mm-hmm. We continue to try to make sure that we don't spread the infection. And we've been doing a good job. If you look at the curve of infection, we're doing much better than we anticipated.
Yes, we are.
And that's because of our community. And I would say that that's because we in our community are a giving community. We know that the sacrifices we make to stay inside is going to help someone who's really sick, someone who's really frail, someone who's elderly. Mm-hmm. Yeah, most of us will survive this without much problem, but we're thinking about the people who need our help. And so whenever I walk the streets and I find it more empty than usual, whenever I see that people are keeping their distance, what's touching me is that people are doing this to protect those who would otherwise struggle if they were infected.
Mm-hmm. Well, Dr. Ton, I love what you said about, the ideal thing, your bias, you want everybody to be healthy. So, the real big concern is our homeless population. And I just wanted to get your thoughts, because I've known you for almost 5 years now, 3 to 5 years, and you have great compassion. So, what are your thoughts on city government and state government and how they've been handling our homeless population? Because I'm still seeing some tent cities along the 99. And, we have all these vacant hotels. And, I know that every hotel or grand motel can't put up the homeless, but what are they doing? Have they been doing a good job in limiting the spread and also, housing them, finding shelter? What are your thoughts on that?
Yeah. So thank you, Felicia, for bringing that up. This, very much it's close to home for me as a psychiatrist who's worked with people who've struggled with housing and homelessness. I've seen the incredible impact that homelessness can have on a person's well-being, mm-hmm. on their mental health, and also on their social well-being as well. And I've seen the positive impact that housing can have. Having something that is stable, that you can go home to, that you can feel safe in, is incredible. Mm-hmm, mm-hmm. One of the things that I think is really important about the COVID pandemic is that it magnifies the health inequities that our underserved communities experience. Mm-hmm. So, if you're having trouble, if you've had trouble accessing healthcare, the pandemic makes it harder.
Yeah.
And the homeless communities are certainly one of the communities that I am really concerned about. Having said that, I've also been really pleased at the kinds of things that are happening in ways that they haven't happened before. Mm-hmm. with regard to supporting the homeless community. For example, Mayor Steinberg has been working very hard with local, health organizations, nonprofits, and businesses to improve the housing situation for our homeless communities. So, just recently they're putting together, and you can read this on the news, a plan for housing for 1,000 homeless community members, along with food, along with other social services as well. So, our hotels are getting together with our public health officials, with our city government, with our community activists. These are the kinds of collaborations that really are important, because homelessness is not just a healthcare problem. It's not just an economic problem. It's not just a policy problem. It's not just a mental health problem. It's at the intersection of a number of challenges. And so what we're seeing is a building of relationships and a deepening of relationships to solve complex health and community issues like homelessness. My hope is that this doesn't end when we've got the best handle on the pandemic, that these collaborations, these efforts will continue. And I've heard, from our city officials that that's the idea, that the idea is that this will continue onwards. I don't know what that will look like, but I feel optimistic that the collaborations that people are making here, that was difficult to make priorly, is going to carry forth onto the future.
Great. Okay. Now, this next question, everybody's wearing masks, the surgical mask, not the I think they call it the N95. How long or do you think we're going to be wearing these masks because it's now recommended, it's not required, that we wear a mask when we go into the grocery store and we're out in public? How long do you think we're going to be wearing masks like this? 3, 6 months, a year?
That's hard for me to predict. What I would say is that the reason why we are asking people to wear masks is in case the social distancing or physical distancing isn't always possible. So if you can imagine walking down the grocery store aisle, in many grocery stores, you can't keep a 6-foot distance. So that's why we're asking people to wear masks. At our hospital, we're doing the same thing, because again, our healthcare providers are working with one another, and sometimes we can't keep that 6 feet distance. So the idea behind the mask is to help build upon that idea of keeping that 6-foot distance, or keeping the distance away so that the virus can't come in contact. The mask helps protect the people around us. So when we're coughing, we cough into the mask, and so that's with the protection. So I would say that as long as there is a tangible risk for infection, we should consider wearing masks if we can't keep our physical distance. The other nice thing about wearing masks is, as we start to ease up on our shelter in, we're still going to need to be doing social or physical distancing. And this is where having a mask can be really helpful, so that we can start to transition back into, our small businesses, working in our organizations, doing things, providing services for others. We can start to make that transition into those areas of work and our economy much more quickly if we have masks. We could do it more quickly and more safely to do that. So it's sort of, having the best of both worlds when we're wearing our masks. The nice thing as well is, if you walk around, people are getting really creative with their masks. Yeah. And that's really neat, because, we have a human need to express ourselves. And when you look at self-expression, a lot of our expression is in our face. Right. And so I'm really happy to see that, even though we have to cover up, that we're covering up, many of us are covering up with designs and symbols that are meaningful to us. And that's a way that we can promote our self-expression, our self-identity, in a way that still, protects our community. So that, I'm going outside now with more of a curiosity of, what kinds of masks am I seeing, and what does that mean about, my neighbors and the people that I care about, and even the people that I don't know. I love the whole self-expression.
So when we talk about COVID-19, and we've talked a lot about how it affects, our community members and, the whole coping thing. So you as a psychiatrist, a dad, a husband, how has COVID-19 affected you personally? And if someone, do you know of people who have actually passed away, and how has that had an effect on you if you knew them?
Yes. So, so first of all, my heart goes out to people who've been affected deeply by the coronavirus. I think all of us have been affected in one way or another. Some of us have been affected much more deeply than others, and I just want you to know, if you have been affected really deeply, please reach out. You are not alone. Reach out to friends and family. This is really important. Please don't isolate. Reach out to mental health providers. Reach out to your primary care physicians. There is help, there is support. This is really important. I have had relatives who have been hospitalized in the ICU from what appears to be coronavirus, but just recently I heard that they have recovered and now they're out of the ICU. So I am feeling very relieved about that. My wife and I are both healthcare professionals, and so we're sort of working and helping to support people in the front lines, as well as seeing our own patients as well in the front lines. And so, we come away on a daily basis feeling both at once a little more tired than normal, but also feeling like we're glad that we're able to help. And healthcare professionals are just one of the people who can help in this. I would say that everybody can help. And that sense of when you go home at night, or when you turn in after a long day thinking, I've made a difference, that can feel really good and can help mentally. And that's what my wife and I, by and large feel. I want you to know, those of you out there, that you are also helping. Sheltering in place, you are saving a life. You might not be able to see the person you're saving, but you are saving a life. You can do things, reach out to people. You are helping people. You can help people. And I want you to know that helping people helps yourself. It helps you to build your sense of connection. It helps you to build your wellness as well. My kids really struggle. My son is a senior in high school. He didn't know that the last time that he saw his friends would be the last time that he would see them in school. He didn't know. He didn't know that the last time he saw his teachers was the last time he'd see them in person, most likely, in his time as a senior. So a lot of, he and his friends are coping with not knowing that. Would I have done things differently if I knew that this was the last day that I would see my folks, my friends, my teachers? They're coping in their own way. They're, again, going on online communities. So we all are in this together. That's the message that I want to send. We all are in this together. We all have the opportunity to connect with one another. There are those among us who are more deeply affected by this than others. But we as an entire community know what it's like to be afraid about this. And that commonality actually helps us to bridge feelings of isolation. So I want you to just know that. I want you to take comfort that with the pain that you feel, please reach out, because there are people who understand, who could resonate with it, who want to be of support. And for those of you who want to support, reach out, because we're all in need in this day and age. And we all have a role in each other's lives and wellness.
Wow. Thank you for sharing that with us. Now, I used to work for UC Davis back in 2001, resigned in 2010, so I can really relate to being an employee at UC Davis Medical Center. I want you to share with us, you know, what does it look like at UC Davis Health with the nurses, the doctors, and, you know, all of the healthcare workers, and, you know, just people who work in the cafeteria, people who are the janitors, and, you know, what does that whole environment look like now with COVID-19? I haven't been to the location probably since February or January, the medical center.
Yeah, well, you know, for a while the activity was lower, and we're really making sure that our essential healthcare professionals and those who support, you know, care were going to the hospital. And so, and the rest of the UC Davis Health community, as well as the university, we were really focused on making sure that that our frontline staff members were getting the support that they needed. So, and it's actually been wonderful. The community has reached out. So people have you know, contributed food. I think one of the things about being a healthcare professional when you're really busy is that sometimes you forget to take care of yourself.
Right.
And then when you realize it, you're struggling between deciding whether to take care of the patient, to go eat, or to use the bathroom. And so I think it's been such a wonderful gift that community members have come up, donated, offered, you know, gifts of food, gifts of, you know, masks, PPEs to keep our healthcare providers protected. And what we saw was people were I think they were afraid to come to the hospital. And so our activity from a clinical care standpoint was going down. And also we were also, you know, making a transition from seeing people in person to seeing people virtually.
Yeah.
So, and that's actually been a strength of UC Davis. So we've been really strong in telehealth. And so we've been really able to build upon that and really quickly respond to the needs of our patient communities through video conferencing. Now we're seeing things emerge. We're seeing people coming to our hospital, to our clinics, to our emergency rooms, as well as we are starting to get a better control as a community, as a city of COVID-19. People are no longer delaying their healthcare, and we want to encourage that. You know, we have very solid ways in which we can prevent COVID-19 from spreading in our hospital. And so for those of you who have been delaying your care, connect with your healthcare professional, nurse practitioner, family practice doc. Let them know about how you're doing, and then they can help you to make the connections, either virtually or in person. So we are starting to come back and focus not just on taking care of COVID-19, but taking care of the things that we've been taking care of for, you know, generations of patients, good healthcare. So we're doing that now. And we're also collaborating with, you know, our county partners as well, making sure that they get the supports that they need. A lot of our docs are the docs working in community clinics as well, and we are keeping that up as well.
Yeah, I think the cross collaboration with the county health department and just other community groups is the great thing to do. I mean, we have to stay, you know, in communication and well coordinated if we're really gonna, you know, fight this coronavirus and moving forward, especially, you know, with testing, vaccines, and, you know, dealing with the whole thing, social isolation. That's huge. That's so huge right now. So one of the things I really wanted to talk about was building up our immune system. So we kind of talked a little bit about that, and I'm real big on that, where, you know, I do Facebook Live exercise sessions in the morning with squats, and Toshan and Dr. A, they know about it. I've been doing this for like 2 years, and I'll do like 30-minute sessions of squats, jumping jacks, and I'm big on cardio. And so I also, you know, am really big on people, you know, drinking lots of water and getting their natural fruits and vegetables in. Fruits, you know, with the natural sugars and the greenest of vegetables. And so I wanted you to share your thoughts on that, especially, you know, we deal with the population, especially the African American population, in trying to get them to realize how important it is to develop a routine, like you said, especially with exercise, to fit, you know, within their limitations, because they'll be the first to complain that, you know, I'm not able to do that, and I would like to exercise, but, you know, so I would just like for you to kind of give your thoughts on what people should do within their limitations and how important it is, you know, for building their immune system.
Yeah. So first thing is take a class with Pochette. It sounds like you're an expert in exercise. I should take your class
I
too.
wish.
Yeah. So I totally agree. This is a really good time to think about how we can all stay well and build up our immunity now more than ever, and to develop habits that we can carry on. This pandemic is not going to last forever. It's going to die down. That's what's going to happen. But we have this opportunity to really share with one another, think really, you know, seriously about things that we can do to keep our immunity going, you know, for years and years and years.
Yes.
So some general principles. Number one, definitely get exercise. Exercise can be very helpful to build your immune system. And it doesn't have to be exercise where you're jogging. It can just be walking, okay? It could be walking at home. You know, now we've seen this like blossoming of online exercise routines, you know, exercise classes. I want you to really consider taking an online class. The reason why is that most people, when we exercise by ourselves, it kind of drops off. It's kind of boring, or we're not beholden to anybody except for ourselves, and we can find excuses not to do it.
Right.
But when we exercise live with a group of people, either in person, which we can't do right now, but online, then we develop conversations, we develop a connection. Those connections help us to stay motivated to exercise and build it into our routine. So before COVID-19, the number of online classes, I mean, it wasn't very many. Now, there are a lot of online classes. There's a lot of opportunity. And so exercise. Number two, good sleep. So you want to make sure that you have good sleep. Of course, good exercise can help you to have good sleep. You want to make sure you exercise towards the morning time or early afternoon. Exercising late at night or in the evening time can interfere with your sleep, but you want to get good sleep. So pick a routine, pick a time that you want to go to sleep. An hour before that time, don't watch the news, don't watch anything that's going to be anxiety provoking. Maybe do some light reading, maybe do some meditation. You can go online, you can go to our office's webinars and look at how we do meditation, but get good sleep. That's the second recommendation. Third recommendation is good nutrition. And so trying to make sure you have fresh vegetables and fruits, I think is really important. If you don't have access to fresh vegetables and fruits, continue to have frozen foods, frozen vegetables. Try to make it unprocessed if possible, but I know that you're working really hard. You might, sometimes for me, all I can do is, in between meetings is to pop, a frozen lunch into a frozen burrito into the microwave. But make sure you try to make sure that you include vegetables and fruits, whether they're frozen, whether they're canned, preferably fresh, but try to get in vegetables and fruits because they are chock full of vitamins that we need to keep our body strong. And consider taking a multivitamin as well. Emotional health. So emotional health feeds into your immunity. So managing your anxiety by the things that we talked about earlier today. And again, we have a couple of sessions that we've done online that can give you tips on emotional wellness. We also have a wellness page that you can access through UC Davis that's run through by my colleague, Dr. Peter Yellow-Lees. He provides wellness resources as well. But maintaining emotional wellness will help you to maintain your immunity. Social wellness. So don't isolate. The more we're connected to a sense of community, a sense of family, the stronger our immune system is. So make sure that you are reaching out. Make sure if you have family members that you feel are kind of lonely or isolated, reach out to them. That's going to help them to protect their immune system, and it's going to help you to protect your immune system to reach out as well.
Oh, I love it. Emotional wellness, I love those new terms. I'm definitely going to go and look up some of those videos you talked about, because, you know, our emotional health is so important. We have to really address that part, because, you know, the mental wellness of us in moving forward, and that goes into my next question. You know, we're going to soon get past this, like you said. And so I always call it the aftermath. Where do you think we stand 1 year from today with the whole COVID-19 crisis?
Well, you know, I've been through with my patients and personally, you know, life-changing experiences, and I would say that COVID-19 is a society-changing experience. You know, it's affected us in a very deep way, just like, you know, and severe illness affects us physically or emotionally in a very deep way. What I would say is that it in some ways, is a test of who we are as a society, and it can show us, you know, a way to be more compassionate, to overcome the usual limitations in supporting each other. And I'm seeing that. We're seeing that. We're seeing people coming together. We're seeing people reaching out. We're seeing the good in who we are as a society. We're also seeing bad stuff as well. You know, there's been an increase in racial discrimination online over the Zoom platform as well. So we're seeing some ugliness as well. But I don't want that to overshadow the incredible opportunities that we have to show who we really are. So what's going to happen after we recover from this? Well, you know, I mean, your guess is as good as mine, but mine is based on experiences that I've had with other adversities and sharing adversities with patients. And I would say that we'll come back more resilient. I hope that we will come back with a better understanding that physical limitation will not limit our ability to help each other. I hope that we come out of this understanding that you know, we can come together, you know, community-based organizations, health organizations, universities, small businesses, that we can come together just as we're coming together in this crisis to solve immediate issues, that we can build upon those relationships to solve issues around health equity, around social justice. I think that that's really important. Now, of course, what I am concerned about, and I think that you know, if any of us is in the position to help, I want to make sure that we support our local businesses. I want to make sure that we support our local grassroots organizations, because you know, in many ways, they're the lifeblood of our communities. And you know, I think that in many ways they're vulnerable in this pandemic from an economic standpoint. So we need to think about making sure that our lifeline in the community, our community-based grassroots organizations, are thrown a lifeline as well through this. And I know that we're all struggling economically, but I think we can put our minds together, find ways to use the resources that we have to make sure that that we all are recovering from this together.
Wow, that's what I love about you, Dr. Ton, Dr. Lawson, and UC Davis. You guys are so supportive of grassroots organizations, small businesses, and you're right. I will have to jump on that bandwagon. We are the lifeline. We're not the only ones, but we are the lifeline of the community, of the society in general. When we talk about the percentage of people, contractors, and independent contractors, consultants, and even employees that small businesses support as a family throughout California and beyond California. So thank you so much for supporting us and being one of our major partners in the community and presenting events, the Black Positions Forum, which is coming up in June, that we more than likely will be doing as a virtual platform with a very, very small support group at the lecture hall at the education building, and other events that we've done in the community. You've been so supportive. And as we come to a close, is there anything else that you want to share with us, or you think that our listeners, our readers would need to know or would like to know?
I think that you've asked great questions, very thought-provoking questions. So I thank you for the opportunity. And those of you who are watching this, I thank you for spending the time to listen. I hope that what we've talked about here you can relate to or you can find helpful. Please spread the message. I think that what's really important in all this is that we maintain good communication. There's a lot that we're doing at UC Davis Health that we're trying to do to help improve community health. One of the things that we've been working really hard on is making sure that we protect our community with regard to COVID-19 and making sure that we have good testing that we're building in place. But this is a partnership. This is something that we can and have to do together. So thank you for listening. Please spread the word, help your neighbor, and help us all stay healthy, well, both from a physical standpoint and from an emotional and social standpoint. Let's take care of each other.
Thank you, Dr. Ton. Now, it is 2:44. So we went an hour and 45 minutes. I'm going to be working with one of my editors to probably edit down this video, because in looking at, I don't think, are any of your videos over an hour long that in this series?
No, okay. We've kept it to about an hour. Yeah, an hour to okay. 50 minutes to an hour.
Okay, so we might do a part 1 and part 2 on this, just to break it up, because we know how people watch things on YouTube. Some people watch things in 10 to 30 minute spans. So that's probably what we'll do. And I'll work with someone to get this uploaded to our channel and then send you the link as soon as it's uploaded.
Wonderful. Thank you so much, Flechette, for all that you're doing for the community. To you're as I said, you're a lifeline in the community. Communication is so important during this time, because that's how we maintain our relationships, and I feel very fortunate that we've had this. Our partnership has been over the span of years, and that we can really work together to get our communities through this pandemic.
Yeah, thank you for believing in us. And we just, we treasure our partnership with UC Davis over the past years once again. And we're just so glad that, you've involved us in being able to be a messenger in the community to carry forth a lot of the topics that you guys are coming up with. I know one last thing I wanted to know, how long do you expect to carry the series? Is it going to go through June?
We plan to hold it indefinitely.
Okay.
Because I think that the pandemic will last for a longer time, because it'll right. Until we get a vaccine for this, we'll have at least some level of awareness and dealing with the pandemic. So we plan to do this indefinitely. It may not be on a weekly basis forever, depending on how many people are logging in. So we'll be responsive to the community. One of the things that we're thinking about, Plachette, in this regard is that we want to cultivate a community of healing. And then as we cultivate a community of healing and helping people to develop tools to help them to self-heal and help them to be well, then we'd like to start to talk about issues around racism and discrimination, because we feel like that by working on the healing and mindful skills, that people will be in a space where they can actually listen with full heart to the problems caused by racism and even their contributions to those problems. So we see the process of healing, the process of wellness as a critical step to addressing discrimination and health inequities.
Excellent. All right, well, we certainly have our work cut out for us. I don't think we have any dull moments. We're going to have to practice on our meditation time. I know that I am. I'm going to start practicing meditation as soon as I get out my bed in the morning, before I even start anything.
That's a great time. Okay, I'm going to hold you to that. So
okay,
I'm ask you next time we meet, okay?
Tell you if I've been. Take care, you and your family.
Thank you.
Till we meet again.
Sounds
Bye.
good.
Bye, Tosha.
Bye-bye.
You're still there.